Hey everybody, Dr. Baker here. One of my patients asked me a question, and the question ultimately was, why would somebody change their mind from going to a medical doctor to a chiropractor? Like maybe they're skeptical about chiropractic, they're set in their ways as far as medical doctors. Like, how do I communicate with them on why chiropractic? Well, first of all, a question for you. When you go to a medical doctor, what's usually the answer? You go in with the symptom and they're going to say, oh, you have that, take this, right? Have you ever gone to a medical doctor with a symptom and not been given a medication? If you have, raise your hand because that's rare, okay? So you're gonna be given a medication, and the majority of the time when you're given a medication, the doctor says you need to take that medication for the rest of your life. And so, let me ask you another question. When you watch TV and the ad comes on for the pharmaceutical ad for the drug, what is the last 30 to 45 seconds always? It's all of the side effects. So let me get this straight. I'm going to go in with a symptom. Part of my body's not working properly. You're going to give me something that I have to take the rest of my life. It's going to cause more problems. And then when I have another problem, I'm going to go into the doctor. I'm going to come back to you, Mr. Medical Doctor, and you're going to give me another symptom for the problem that you caused with the first medication. You're going to give me another drug to cover up that symptom. Interesting. And it just does this, right? That's called modern medicine. That's how it works. You want to talk about things like opioids? Pain is caused by inflammation. And opioids do not remove inflammation. They don't fix the cause of inflammation, right? No one's talking about the cause. Yet what they do is cover it up, make you dependent on the drug, and they create an extreme state of apathy. It's been shown that opioids affect your frontal lobe and ultimately affect your ability to feel emotions, which means the reason why your friend who's on opioids looks like a zombie all the time, doesn't want to hang out or do anything, because neurologically that's what the drug is doing. So then the question becomes, well, what's the answer then? Like, if taking drugs isn't the answer, which duh, why don't we address the cause of the problem? And so let me talk to you about the nerve system, the body, how it heals, how it works, and the cause of why you'd be having a symptom. So here's the coolest thing in the world. Your brain runs the entire show. And it does that by sending information, messages, power, intelligence down your spinal cord and out the nerves to every single part of your body. And that's how everything works. Think about this. Your heart's beating right now. Your lungs are breathing. Your food is being digested. If you cut your finger, it will bleed and scab, but eventually heal. And the reason is because you have this amazing intelligence inside of you that's running the whole show. But here's what happens. If it doesn't get to where it needs to go, that's a problem. If I come along and I cut the nerves to your heart's dead every single time, no matter what. Doesn't matter what you believe, that's what happens. Now, question for you. If I put constant pressure on this nerve, instead of cutting the nerve, I put pressure right there, squeezing it. Over time, is your heart going to get healthier or sicker? So the point is, anytime there's pressure on a nerve, anywhere in your spine, wherever that nerve goes, that part of the body can't keep getting better, but instead it's going to get sicker over time until you have symptoms. And then if it's left, diagnosis, disease, dysfunction, and so on. So if you want to get rid of symptoms, you can keep going to the doctor, right? You can keep going to the medical doctor and be like, hey, can I have some drugs to cover up some stuff and make me worse? Or you could address the cause of the problem. And the cause of the problem is almost always pressure on your nervous system. So if you have asthma, could you have pressure on the nerves through your lungs? Yes. If you have high blood pressure, if you have digestive problems, could that be a problem with your low back? Could that be why you have low back pain and digestive problems, or low back pain and an irregular cycle? So there's two reasons why you'd have pressure on a nerve. Number one, you have two vertebrae that are stuck and don't move. Right? Every one of your vertebrae is supposed to move. If it's stuck, it's called a subluxation. That creates inflammation. The inflammation is what puts pressure on the nerve, shutting down your organs. It's that simple. Number two is anything structural, Meaning if you've lost the curvature in your neck, you have an abnormal curve in your thoracic spine, pelvis is rotated, anything structural is going to cause pressure on the nervous system as well. So if you have one of those two things, I can almost guarantee you that that's the root cause of why part of your body is not working very well and why you have a symptom. Your call on what you do with that, but my suggestion would be you find a good chiropractor wherever you're at to be able to evaluate your nervous system, do an exam, and then take x-rays, because without x-rays, we can't really see the structure.